Diagnosis by visceral organs. This time we talk about lung illnesses. The main disturbances of the lung concern its functions of governing qi and respiration and its defense of the superficies. Deficiency of lung qi. Syndrome of lung qi deficiency results from deficiency of lung qi and its inability to secure the superficies. Deficiency of lung qi is mostly due to two circumstances: an illness of chronic cough, wearing down lung qi, and insufficiency of the spleen and the stomach, with resultant inadequate digestion. When lung qi is deficient, the thoracic qi cannot be generated adequately, and deficiency of the thoracic qi leads to reduced respiration, impaired dispersion and depuration functions, compromised security of the superficies against exogenous evils, and general decline of the entire body's functional activities. The typical syndrome of lung qi deficiency is as follows. There are a weak cough, shortness of breath that is aggravated by exertion, soft voice with reluctance to speak, weariness, pale complexion, spontaneous sweating, wind intolerance, susceptibility to exogenous illnesses, and thin and clear sputum. The tongue is pale with white coating, and the pulse is depletive and feeble. Deficiency of lung yin. With deficiency of lung yin, symptoms result from endogenous heat arising due to yin deficiency. Three circumstances induce deficiency of lung yin: chronic cough, damage to lung yin in late stages of heat illnesses, and injury to lung yin by the tuberculosis agent. When lung yin is deficient, the lung loses its nourishment, so that deficiency fire arises and the lung loses its dispersion and depuration functions. In deficiency of lung yin, the cough is unproductive of sputum or productive of scant sputum that is viscid or blood-streaked. In addition to the cough, the typical syndrome includes a dry throat with hoarse voice, flushing of the cheeks, recurrent fever with night sweat, hotness in the 5 centers, a red tongue with little coating, and a thread-like and rapid pulse. Wind-cold binding lung. This is a condition in which exogenous wind and cold bind the exterior and impair the lungs' functions. Exogenous wind and cold bind the superficies and induce dissociation between the superficies and defensive qi. Lung functions also become impaired. The typical syndrome of wind cold in the lung includes coughing productive of thin white sputum, clear nasal discharge, chills and mild fever without sweating, headache and body aches, a thin and white tongue coating, and a floating and tight pulse. Thank you for listening.